From Connecticut's news leader, this is NBC Connecticut Today at 11.
Well, we use it every moment of every day, but many people are lax when it comes to the health of their mouth. Joining us now is Dr. Eisenberg from the UConn School of Dentistry to talk about some of the common pitfalls. Good to see you, Doctor. Thanks for coming in.
Thanks for having me.
So we're talking about oral pathology today, and the first thing that came to my mind is, what is oral pathology and why are we concerned about it?
Oral pathology is a dental specialty. It's a diagnostic specialty. And while the oral pathologist generally doesn't do dentistry as you would know it, what we do is we see patients who have problems that are a little bit off the beaten track. So the dentist would see patients and do an examination and find where they need to have fillings and that sort of thing in periodontal care. Sometimes they find something unusual or something different in the mouth that affects the soft tissue, sometimes the hard tissue, and the oral pathologist is called in to sort it out.
Like many things, the tendency with a lot of people is to have a little nagging problem that isn't causing a major change in their everyday life, and they ignore it. They say, I'll get it looked at next month, maybe it'll go away. There's a lot of reasons why that's not such a good idea, right?
Oh, there's a million reasons why that's not such a good idea. Putting everything in perspective, most things that happen in the mouth are entirely benign. And they're usually reactions to things that are irritating and directly applied to the oral tissues. However, sometimes there are other influences that are well beyond the mouth, and they can be serious, potentially serious. There are certain infections, there's even cancers that can occur in the mouth, and it's very important to have things checked so that they don't get out of hand.
Right, and there's a potential, if you do leave it unexamined, there can be a domino effect, and it can not only impact your mouth, it can impact other parts of your body, especially if it's something serious, correct?
Definitely. You know, the mouth is part of the body.
Right.
And I had a teacher one time who said, where would you be without the lower third of your face? Think about that. This is really part of the body, and we sometimes disembody the mouth when we think about dentistry, but it's really part of the entire system.
So what is the best practice for anyone out there to make sure that they have some sort of exam in their mouth, whether it's with a traditional dentist once a year, twice a year? What is the general thinking of that?
Well, whether someone has teeth or they don't have teeth, they absolutely should see a dentist at minimum once a year. And the ideal is actually twice a year. But certainly an examination on everyone is very, very important.
All right, Dr. Eisenberg, thanks so much for coming in. Good advice.
Thank you for having me.
All right.